Good morning, everyone, and thank you for joining us today. My name is Samantha, and I am a Marketing Communications Associate here at Commonwealth Purchasing Group. For those of you who are unfamiliar with our program, we are the leading group purchasing organization for community health centers and other nonprofit organizations. I encourage you to visit our website, cwpurchasing.com, to learn more about how we can help your organization save money. Today, we are very excited to have Hira Rashid, Senior Learning Program Manager at MedTrainer, and Carla DaCosta, Solution Consultant at MedTrainer, here to discuss building a compliance training program that works. Let me tell you more about MedTrainer before I introduce our presenters. MedTrainer streamlines compliance with an all-in-one online platform that helps healthcare organizations educate their teams, credential providers, and manage compliant documentation. More than 15,000 healthcare facilities depend on MedTrainer to standardize compliance training, and 100% of community health centers using MedTrainer passed an inspection in the past year. Now I'd like to introduce our presenters. Hira Rashid is uniquely positioned to help healthcare organizations with their compliance training. Hira earned her master's and PhD in public policy, and she uses that experience to ensure MedTrainer's continuing education courses meet meet state board standards, are updated to meet regulatory changes, and Hira helps customers maintain accreditation. Carla DaCosta helps MedTrainer solve their unique compliance training challenges. With over 5 years of experience in the healthcare industry and is working as a psychologist and therapist, Carla has a deep understanding of the complex regulatory requirements and challenges healthcare organizations may encounter. At MedTrainer, Carla works closely with clients to understand their unique needs and provide customized solutions to meet their compliance and learning management needs. Today's webinar is designed to last 30 minutes for the presentation portion and 10 minutes for questions and answers at the end. If you have a question, please type it into the chat and I'll be sure to share it with Hira and Carla after the presentation has concluded. I also have some poll questions that will be coming up shortly. And at this time, I'd like to hand it over to Hira and Carla. Thanks so much for being with us today.
Thank you. So Hira, what will be covered today?
So in this webinar, Carla, thank you, we'll cover the need for training compliance, specifically how compliance requirements that are healthcare organizations are legally obligated to abide by or meet, how to make sure that those are correctly identified and avenues for meeting those needs are met. Delivery mechanisms, the importance, the structure, the value that those mechanisms bring, and then how to streamline reporting. And Carla, I think you're an expert on this, but if reporting isn't streamlined or consistent, it's not a good way to be compliant with healthcare regulations. So these are the 3 main topics we're covering in the webinar today.
Thank you. So before we start, we wanted to ask everybody here today a question. So as you can see on your screen, there are 3 questions. So if you could please help us respond. Are you a CPG member? Do you have a compliance training in place now? And how would you rate your compliance training? We also would like to know how is it set up and have you ever had to decline any patients? So go ahead and please respond. Okay, thank you for that. So Hira, can you explain to us a bit more about compliance and why is it important in the healthcare industry?
Sure, absolutely. So after years of kind of trying to parse down the information and the complexity of compliance, I've kind of established that it all kind of falls into three levels, the first being federal. So this is the bare minimum of what you must do as a healthcare organization. So, and I'm sure everyone here has heard the names OSHA, CMS, OIG, HHS, Office of Civil Rights. These are the big federal regulatory organizations that ensure that overarching civil rights laws, patient care laws, employee safety laws, corporate compliance, fraud, waste, and abuse, those topics are covered in a broad way. And then also, I'm sure as many of us know, if it's the federal government, the stakes are that much more higher because, you can get into audits with OSHA, you can get into, audits for HIPAA compliance, data breaches, Medicare fraud, waste, and abuse, and things of that nature. So it's really important to know and stay up to date on what those federal requirements are. The second tier is state requirements. So states often either default to federal baselines or for regulatory compliance, or they add a layer of training requirements. So for instance, 28 states, OSHA federal laws prevail, or OSHA federal standards are what has been adopted by the state government. But 22 states have created their own additional layer of employee safety mechanisms for OSHA. So similarly, right now, for instance, harassment training isn't mandated at the federal level, but it is at the state level, cultural competency, implicit bias. And then in some instances, states that are struggling with specific issues, such as human trafficking, may choose to mandate that training for their healthcare providers as well, to make sure that those issues are identified and correctly addressed at the state level initiative. The third layer then is accreditation compliance. So often, we actually, in my experience, we work with a lot of organizations that have accreditation, and they value and want to keep their accreditation because it's so hard to get, and it brings them all sorts of benefits. So it might bring them better patients, even better employees in some instance. And so accreditation are really hard to get. They're very arduous in terms of paperwork, in terms of just meeting the requirements for quality of care and quality of processes. One big one that I think a lot of folks here might be familiar with is the Joint Commission. They do their own, they have their own training stipulations. So, we identify what those training requirements are. And then generally these requirements will surpass or go a little bit beyond the baseline regulatory requirements. Okay, so some other sources of training. So we covered federal, state level, and then accreditation. So some other sources of training requirements that you might encounter as a healthcare organization are if you're funded through a grant, if you're launching a program that requires a grant or that is grant funded, the grant might include specific requirements for staff training, depending on what the nature of the grant is. Increasingly, private insurance payers, such as United, are asking healthcare providers and organizations, especially those enrolled in, specific state Medicaid programs, for instance, or other specific quality improvement programs, or a specific tier of an insurance program. They're asking for training requirements to be met at the organization level for those providers, and then state level program specific partnerships. So often in some states, what you'll see is, that the state government is very active in collaborating in building public-private partnerships. And often with those partnerships, what they end up doing is creating training requirements to ensure that quality of care is maintained, even though they're transitioning a little bit of those services and the responsibility for those services to the private sector. So for all these training requirements, if you don't have a training program in place or a mechanism to have a training plan, it can have multiple issues for your organization. So it might be that your staff feels burnt out, or that you're not maybe spending your time most efficiently. You have to decline patient appointments, things of that nature. So really what our training program should focus on is training efficiency by looking at the frequency of training, developing role-specific training, and developing training that caters specifically to your organizational needs. And not every training will, right? So I think that's the big takeaway also, is that there's so much noise out there in terms of compliance. Everyone's trying to get you compliant. Everyone's trying to email you and saying like, hey, get this training, get this webinar, get this, and so that it's really important to know what applies to you so that you can use your time and resources most efficiently. In terms of frequency, it might be, you have to do training annually or twice a year, or sometimes often it's once every 2 years. Knowing that is extremely important. Making sure that you're not inundating your staff with training that doesn't apply to their role is extremely important. And like I said, organizational needs. So really, if your organization, often we get questions around disaster preparedness and emergency preparedness. And so folks will ask us, like, can you help us or train us on developing an emergency preparedness plan? But really, it has to be focused on your organization's needs. If you're located in a downtown location, right, your emergency preparedness looks very different than if you're located somewhere, in a sparsely populated area that takes 15 minutes for first responders to get to, right? So it's very different. Then really what we want to focus on in this webinar, and Carla will also speak to this, is we have to it helps to identify overlaps to streamline training, so you're not doing repetitive training. You can save time. You can create a schedule to leverage those months when you have relatively lower patient volume, and you can bundle topic-specific trainings to maximize retention. So a good example of this is if your state has, at the state level, you have, for instance, breach notification requirements, data breach notification requirements, and at the federal level, you're doing HIPAA training to be compliant. It's always good to tie one to the other, because you don't want to be doing HIPAA training in January and then in June be saying, hey, by the way, did you know that our state also has a data breach notification requirement? Because it doesn't help employees connect the dots, and it may increase risk for your organization. So I think that covers everything on this slide. If we can go to kind of piggybacking off of my example about the data breach notification, just in that one area, the number of breaches have increased significantly. So this is a graph that shows it's data collected through the HHS, and it shows that data breaches have consistently trended upward over the last 10 years. So and doubled over the last 3 years. So as healthcare organizations and healthcare industry in general transitions more to an electronic system for patient records, for communicating with insurance providers, even for messaging with patients, right? The data breach risks have increased significantly because of that. And it's important to protect yourself, train your employees, and make sure that they're aware of the risk that your organization is facing, specifically with the systems that you have in place.
And here's where the importance of having an integrated system comes to play, because it would be much better to be proactive rather than being reactive. So of course, after an event like a breach, training is a quick way to show how you took preventive action, but a solution that allows you to be prepared and be well trained before unexpected situations come will make it much easier to respond and much faster to respond. So if you have an integrated system that allows you to report incidents, train your staff, keep track of logs, your policies, it will be much more efficient. And if you have a breach, then you know what to do and your staff members know what to do. But the idea is to be proactive to avoid getting to a situation like that. Certain things that will be unexpected, like a pandemic or the tornado that just destroyed the Pfizer, those kind of things will always be unexpected, but you can step ahead of the game. So training will protect you against legal liability, and that's why it's important to have a well-designed training program in place. Now, how is your current training program set up? I know you responded this, but we were curious to understand, because there are many different ways that you can create a program training, right? So you can either do it on your own and just conduct in-person training. You can do the training online, and you can also subscribe to a learning management system, right? So we're going to be discussing why it's important to have a very well-designed, specifically on the creating, delivering, and tracking assignment for the trainings.
Thanks, Carla. That was, I think, very comprehensive. So I think the first part that I can speak to is creating and the importance of creating good training content. And again, training content that's efficient, applicable to your staff, and meets specifically your needs. So first of all, it's important to recognize that it's more than just checking a box. So often, when I consult with clients, I have to explain to them that just doing OSHA training and meeting the bare minimum requirement just to check a box is not really going to be in their best interest, because a lot of, as Carla mentioned, a lot of this training is designed to help you from having any legal liability in the future, right? So it's supposed to make sure that you're reducing the risk of incidents that might get your organization in trouble, that might lead to adverse patient outcomes, maybe like errors, medication errors, errors in the healthcare, other errors in the medical errors in the healthcare facility, things like that. So it's really important to recognize the relationship between training and risk mitigation, rather than training and just being compliant for the sake of being compliant. So I think here is where there's a couple of things that, as tips go, we want to point out to you. A lot of the training now is being regulated at the state level. I think a lot of that has to do with the amount of financing that the healthcare industry requires from public funds. And so a lot of state governments and federal government and the federal government is asking that training be provided by specific pre-approved providers. And for that to happen, providers or training providers, such as the organization that I work for, we have to submit an application to the state agency, become approved. They'll review they'll do a thorough review of the curriculum. They'll make sure our SMEs are legitimate and credentialed, and then they will approve that training program. Often what happens is, if healthcare organizations are not aware of this requirement, they'll have their staff complete the training. When it comes down to submitting a completion certificate, the state agency will come back and say, this is not an approved provider. And then you're stuck because you've kind of increased the risk for your employees because you haven't completed the training. And then you have to invest double the resources in making sure that you now go to an approved provider, because ultimately you have to meet that training requirement. The second thing is trainings are increasingly being asked to be interactive and include multimedia, and also be ADA compliant. Of course, that's something that all learning providers have been transitioning towards for the last decade. It's become even more important and sort of more streamlined now, where it's a baseline request for training providers to meet. In some instances, providers must also follow specific learning formats, such as case studies. So a good example is New York, where harassment training is required. The state actually says that the training must be scenario-based and must focus on scenario-based learning. So I think one way that we often think about creating training within healthcare is we have so many brilliant people working within our organizations, right? And so often what happens is that, your person that's been working in the organization for 20 years, has clinical and compliance experience, has been an administrator for a while, is the go-to option, right, to be a trainer. But often that doesn't work out because they might already have a critical patient load, and they might not have the time to maintain updated materials. They might not have the time to scour the web and all the state websites and all the federal regulatory websites to make sure that all the training needs are identified. So because of those limitations, sometimes it's better to rely on staff whose specific role is to take care of your needs related to compliance. What that looks like is compliance managers and training coordinators. I know that this is like an upfront investment for a lot of organizations, but this saves a lot of time and money down the line, if, in legal fees and in making sure that you're, scrambling to get compliant. If you realize that, for instance, you haven't been updated on a training new training requirement, and you now ultimately have to cover it for all your staff. So the tip here, the big takeaway here, is you should plan for trainings to face increasing scrutiny from regulatory and accreditation agencies. This is a train that's only going one way. It's going to be more scrutinized. It's not getting more lax. So when you see a new training requirement, check to see who the approved providers are and make sure that those providers are giving you good training that helps retention of content using multimedia, ADA compliance, and specific learning formats.
So we've discussed the struggles of creating the content and actually being in compliance with the contents, right? But what about delivering the content to your staff? Have you ever had to decline accepting new patients or appointments to conduct training? This is something that we encounter a lot with our customers, because if you're conducting in-person training or you want to have certain days scheduled for training, it might result in a lost revenue, right? So to be in compliance on all the three levels, you're required to have a training plan. And the way you deliver those contents will make a huge difference for your staff members. When you're conducting in-person training, if your staff members have heard of these topics before, they might feel like they're losing their time, they're wasting time. Not everybody learns at the same pace and at the same way. So there are visual learners, there are more auditory learning. So there's a lot that you can do when you find a solution that provides flexible trainings. So the idea here is to find not only the contents that are good and suitable for your type of industry, the place you're located at, and the kind of regulatory compliance you need to follow, but also making it easy for your providers so it's fast for them, it's efficient, and they are actually engaged with the learning content. So when your providers can pause and take the quiz online, it makes a huge difference, right? So an LMS can ensure your staff has access to ADA compliant, inclusive, and culturally diverse trainings. It makes a huge difference than what Hira was explaining. If you have a person that has experience at your company and they're conducting the training, they might be even biased, and that's okay. That's why we create content that is more inclusive, and it will be much more efficient for your staff members. But what happens after you've delivered the content, right? You also need to keep track of those trainings. Our VP of compliance always says something: if you don't document the training, it never happened. And that's right. So reporting isn't only for you to know who's completed what, but it's important for you to show during an audit. Those are the kind of things that regulatory or governing agencies will ask for. So there are a lot of struggles of maintaining records without a digital solution. I don't know if you've heard of this or if any of you even does this, but passing, for example, the sheet of paper, right, during an in-person training. We've heard that. It still happens, right? Passing around the sheet of paper, getting the signature. What happens if that sheet of paper gets lost? And that is not even enough for a governing agency to come and review. So using technology will allow you to even customize the reports to find the specific information that you need. Not only who completed the training, but who's missing, who completed the quiz, who passed the test. So there's a lot that you can do with a digital solution. And then there's other scenarios like the new hires, right? So if you have your compliance training set, I had a company that had compliance month, right? So everybody conducted training during compliance month. But what happens with a new hire that is hired 3 months after? They're not on the same schedule than everybody. And if you're not taking care of that, you might fall out of compliance because of that one person that isn't following the schedule for the rest. So it's easier and faster to have a way to be very well organized, and it will be much more efficient for you. So at MedTrainer, we do have a unified platform. So everything that we've covered today falls within our scope. We have MedTrainer Learning. And one of my favorite things about this is that we don't only have the regulatory compliance courses, but we also have courses for skill development, for CE license renewals. We have a lot of different things in here. We also have compliance. So like we were saying, having an integrated platform with not only the learning, but having also the ability to document your policies and procedures, having the ability to create incident reports online, and things like safety data sheets or safety plans that also are required for your compliance. We have them too. And then we also have credentialing. So we have different solutions for your credentialing needs that will, of course, tie to your learning and compliance needs. So this is what we had for you today. Thank you so much for joining us. And we're going to have a couple of minutes for questions.
Thank you so much. If anyone has any questions, they can type them into the Q&A section or the chat. and I am happy to share them with our presenters. Okay, Carla and Hira, thank you so much for joining us today. Everyone, this webinar will, because it is recorded, it will be on our website, and I will also send it to you via email as well. Thank you and have a great day.